1. What is norovirus? A super infectious virus that often peaks in winter. Norovirus outbreaks frequently occur from November to March. It spreads quickly in group settings like schools, nursing homes, and workplaces. A tiny virus with a powerful impact. Although very small in size, around 3040 nanometers in diameter, it causes severe symptoms such as vomiting and diarrhea. Infection can occur with just a few viral particles, making it extremely contagious. Why it's hard to prevent. Alcohol-based sanitizers alone are often insufficient. It can lurk almost anywhere, so regular hand washing, proper use of disposable gloves, and thorough cleaning are key defense measures. 2. Main symptoms of norovirus: vomiting and diarrhea. Vomiting is especially common in children and the elderly, raising the risk of dehydration. Watery diarrhea, sometimes described as water-like stools, is another hallmark symptom. Mild fever and overall fatigue. Body temperatures may rise to about 3738, 98.6100 for F. Some people may also experience body aches, fatigue, or mild headache symptoms similar to influenza. When symptoms appear, the incubation period typically ranges from 24 to 48 hours. Symptoms generally last 13 days, though prolonged diarrhea can cause significant fatigue. 3. How norovirus spreads. Fecal or root from contaminated hands or food to your mouth. Infection can happen when you touch contaminated surfaces, e.g., doorknobs, towels, and then eat without washing your hands. Shellfish like oysters can accumulate norovirus. Eating them undercooked or raw poses a high risk. Droplet infection, aerosolization, invisible particles in the air. Virus particles can disperse into the air when someone vomits or has diarrhea, and others may inhale them. In closed or poorly ventilated spaces, they can spread rapidly. Secondary indirect infection, passing on the virus without knowing. If an infected person touches items or surfaces and someone else then touches the same items and later touches their face or mouth, infection can occur even after symptoms subside. Norovirus can continue to be shed in the stool for up to several days, risking further spread if hygiene is neglected. 4. Practical ways to prevent infection. Thorough hand washing, soap, running water for at least 20 seconds. Especially important after using the toilet, before eating, and before cooking. Since norovirus is relatively resistant to alcohol alone, physical washing with soap and water is essential. Fully cook food, ensuring the center is heated well. Norovirus is generally inactivated by heating to 8590, 185,190 for F for at least 90 seconds. Shellfish, e.g., oysters should be thoroughly cooked. Avoid eating them raw or partially cooked. Clean and disinfect utensils and cooking equipment. Use chlorine, bleach, sodium hypochlorite, or hot water 85,185 F for at least 1 minute to disinfect. Wash utensils immediately after use. Don't leave them sitting around, as the virus can remain infectious for a long time on surfaces. Handle vomit or fecal matter with full protective gear. Wear a mask, disposable gloves, and a disposable apron to minimize exposure to airborne particles. Wipe up the area with paper towels, then disinfect with a chlorine-based solution. Dispose of contaminated paper towels and gloves in a sealed plastic bag right away. People with suspected infection should avoid close contact and food handling. Refrain from handling or preparing food if you have active diarrhea or vomiting. Even after symptoms improve, pay extra attention to hygiene, especially hand washing after using the toilet to prevent passing the virus on. 5. Treatment and medical points. No specific curry treatment is mainly supportive. There's currently no widely available antiviral medication specifically for norovirus. Most therapy involves rest, adequate fluid intake, and treating symptoms as they arise. Don't overlook the risk of dehydration. Persistent vomiting and diarrhea can lead to significant fluid and electrolyte loss. Use oral rehydration solutions, e.g., sports drinks or medical rehydration products if possible, and watch for signs of dehydration, such as severe fatigue, dizziness, or very dry lips. Keep an eye on severe or prolonged cases. Children, the elderly, and those with underlying health conditions are more prone to complications and may require hospitalization. Seek medical attention if vomiting is uncontrollable, or if someone cannot eat or drink enough to stay hydrated. 6. Summary. Norovirus is a wintertime staple of acute gastroenteritis, notorious for its extremely high infectivity and intense symptoms, vomiting, and diarrhea. Even a small number of viral particles can infect someone, so it can rapidly spread in group environments. Thorough hand washing and proper disinfection, especially using chlorine, bleach or heat, are crucial, since norovirus is relatively resistant to alcohol-based sanitizers. Careful handling of vomit and stool is essential to prevent secondary spread. If you or someone around you is showing symptoms, pay close attention to hydration and seek medical help if needed, especially for high-risk individuals, such as young children and the elderly. Bottom line, norovirus prevention relies heavily on high-level hygiene practices and awareness. By maintaining good hand-washing habits, properly cooking foods, and disinfecting surfaces, you can significantly lower the risk of infection and protect yourself and others from this highly contagious virus.